Okay, here we go. I get so many questions about this idea of full body MRIs that I want to show you the results of the one I recently did just about 8 days ago in LA. I do these through an organization called Next Health, fantastic company that does a lot of diagnostics and treatments, and they're in a lot of major cities. But the actual MRI company is called Prenuvo. So when you get one of these tests, you do want to be careful because you'll find some things that might be benign or non-problematic that might make you freak out and want to, go and dig into the four corners of the medical planet to fix. Anytime you're looking at a full body MRI, you want to take into consideration a couple of things. First of all, the reason I don't recommend these for everybody on mass scale is because, well, A, they're expensive, and B, it would burden the medical system with a lot of unnecessary procedures and a lot of people worried about things that they might not need to be worried about. Yet, if you are one of those people who might fall into the category of someone who loves to self-quantify, to biohack, to take deep, deep dives into your own health, and you're able to look at things through like a reasonable lens or have someone in your back pocket who's able to walk you through these things, I think you can find some interesting things on a Prenuvo. I'm not going to make this video too long. I just want to walk you through some of the findings. Both my wife and I have done these recently, and we think they're very interesting. So you can see on the left side here, it's laid out based on nervous, respiratory, circulatory, endocrine system, etc. So each of the systems will show you if there's any major findings or if there's any interesting informational findings. For example, you can see here circulatory system. I'm happy to see, heart, spleen, lymph node chain, cervically, all checks out just fine. Total green light. Same thing for endocrine system, right? No issues with my adrenals or my thyroid. Anatomically, no issues with the urinary system. The digestive system looks like we've got one minor finding, and then the reproductive system, one informational finding. Now, an informational finding, really all that looks at is something that might be interesting information for you, but nothing that you necessarily need to act on. In this case, this is telling me information about my prostate volume, which really is not anything super interesting and not something we want to spend a lot of time on this video for unless you're curious about the size of my prostate. But let's look at some things that I actually am concerned about or would love to learn a little bit more about. First of all, looks like three major findings, one in my brain, one in my spine. Let's see what one of the major findings in my brain was here. So when I click here, you can see these two little arrows pop up. It's actually taking a little longer to load than I would have expected. So let's go back here and look at the spine. We're waiting for that to load. Okay, you can see here there's a little bit of spondyloarthropathy of my cervical spine, right? This is basically a little bit of degenerative arthritis in my cervical spine. You can see here I can click to expand and see at my C5, C6, I have a little bit of protruding or bulge-like abnormality. Now, I'm asymptomatic. I don't have any problems with my neck, but this is good to know for me in terms of continuing to do the neck stabilization and traction exercises that I do to maintain pain-free status despite some degeneration. Same thing in the lumbar spine. And I've been told this before by people who have done x-rays of my lumbar spine and from previous MRIs. I have severe degeneration of my L1, L2 disc. I have L4, L5 disc bulges, L5, S1 issues. I'm relatively pain-free in my back, though. And the reason for that is I pay a great deal of attention to my core strength. I pay a great deal of attention to stretching my hip flexors and strengthening my glutes and doing a lot of deep abdominal work, not like crunches and sit-ups, but work where I'm really focusing on breathing and stabilizing the spine. This is a perfect example where, one doctor might look at this and say, dude, spine surgery, go in. Or another doctor might look at it and say, let's get you in for, $50,000 of stem cells in Mexico. For me, I think that back pain, despite showing up as degenerative arthritis, can really be managed quite well with exercise and posture. And so, right now, I'm sticking to my guns and continuing to do what I am doing. But it is interesting to see this manifest. Let's go back up here and click on the brain. Now that things seem to be loading a little bit better. Here we go. So punctuate left pontine flare hyperintensity. That's a mouthful. Maybe a few words in there you've never found yourself thinking about or saying before. You can see here, if the patient is asymptomatic, the finding may be followed on the next screening study. Typically, when you see a little bit of what might be inflammation here or some type of effusion in neural tissue, I've got no headaches. I've got no brain fog. I've got, very minor sleep issues. I've got nothing to indicate that this would be a problem. This would be one of those findings where if I did want to do some deeper digging, I could go talk with a neurologist. And I actually am going to go down to Dr. Daniel Amen's clinic and do what's called a SPECT scan of my brain later this year. But this is, again, a finding that would make you feel super concerned, but I'm asymptomatic. Like my brain works fine and I've got no symptoms that would indicate this is an issue. Let's keep going through a few other interesting things. So respiratory, I got a full body MRI 5 years ago. It showed this exact thing, that I have some inflammation in my paranasal sinuses. Now, I nose tape and mouth tape when I sleep. I get the occasional balloon cranial adjustment, which is just what it sounds like, getting your skull bones adjusted with a balloon. And I have podcasts on all these kind of things. I even have a handy AI function at bengreenfieldlife.com where you can ask my AI, hey, tell me what Ben's done for his sinuses, and you can find it in there. But even though it's showing that I have some abnormalities in the sinuses and the mastoids, again, I'm asymptomatic and I actually breathe pretty well, don't struggle with allergies. The only time this has popped up before with me has been when I'm free diving and I take a mucus thinner and it seems to work just fine. So my wife has shown the same thing in her sinuses. A lot of people do, to be honest with you, a little bit of sinus inflammation. So again, nothing to like drop everything and run to a doctor about, but interesting findings. Digestive system. Let's see what's going on here. Liver. Now, when I click on this, people, if they saw this, would be concerned if you click on hemangioma, because you can see here there's an 11 millimeter growth on my liver. Well, guess what? I had a similar size growth 5 years ago. These hemangiomas are a very common and benign growth on the liver. I've also had a fibroscan and a more specific MRI of the liver and shown it to be non-problematic. I was even told I have the liver of a newborn baby. So again, I'm not concerned here, but it is interesting. It's something that if I were to get a full body MRI every 3 to 5 years, I would keep my eyes on it to make sure there's nothing going on here as far as growth. And in the past 5 years, it's not manifested at all in any type of growth. So I think those are some of the major findings that I wanted to just demonstrate to you, those of you who are curious of what a full body MRI looks like. Let's go over one more. Pelvis and hips, right? I am pain-free in my pelvis and hips. However, when I click here, it's showing me that I have a bursa-filled sac, bursitis, in bilaterally in my hips, right? And I, similar to the low back stuff, do a lot of hip openers, pigeon poses, four-legged triangle chair stretches, such as a hip opener lying on your back that you do in yoga. I don't have any hip pain, knock on wood. Although the MRI is showing me that I do have a little bit of bursitis there. This will simply influence me to continue to care for my hips the way that I have been doing. And I will probably run this by an orthopedic friend of mine just to make sure there's not anything else that we could be thinking about related to this. I'll also talk to a guy who sometimes does stem cells for me to see if he has any recommendations in that regard. And then knees, you can see here I have some degenerative bilateral, basically arthritis of my knees. And I'm aware of that. My right knee is completely pain-free. My left knee, again, I do a ton of strength training. I keep the vastus medialis strong. I do a lot of stretching, especially for the hamstrings. I'm 85% in that left knee. If you would ask me 5 years ago, I would have said 30% until I started to do Ben Patrick's Knees Over Toes program. And I started to pay attention to strengthening the VMO and doing stabilizing exercises for the knee and really good stretching. I would probably be hobbling about if I didn't pay a lot of attention to strengthening the muscles around my knee so this cartilage degeneration doesn't become an issue. If someday they develop some type of cartilage scaffolding or, the magic gel from Germany turns out to actually work, I would consider doing a treatment for the knee. But right now, about all this holds me back from a really heavy, deep squats and like sprinting through the mountains. And I'll admit, this is probably due to like 20 years of masochistic Ironman and adventure and Spartan racing that I've really done a number on my knees, especially for a big lanky guy like me. And then effusion, that's an abnormal collection of fluid in the joint space that shows in my left knee. That's probably because I have a slight meniscal tear in my left knee, and that tends to lead to a little bit of fluid leakage. Again, I stay on top of it. I take care of my knees. I strengthen them. So ultimately, as you can see here, the main thing I wanted to do was A, show you what the results of the full body Prenuvo MRI look like, and B, kind of walk you through the idea that you don't necessarily have to like run to every specialist on the planet to get this stuff treated. A lot of it comes down to caring for your body, especially your musculoskeletal system, staying on top of things, watching in a prudent manner. If anything's symptomatic, especially from a nervous or an endocrine or digestive standpoint, for sure, pursuing that. But ultimately, this video is just meant to give you a good handle of what the full body MRI looks like, some things you can learn about, and some things not to freak out about. So thanks for watching, and I hope this was helpful.